An 18 years old athlete attended to orthopedic clinic reporting pain swelling over the medial aspect of the knee joint. So there is a pain and swelling, that means there is a inflammation in the medial aspect of the knee joint. The pain occurs when climbing the stairs but not present when walking on flat ground. Clinically, the pain is over the medial proximal tibia and the McCurry test is negative. What is the cause of this pain and swelling? Here the answering options. Options are anterior cruciate ligament tear, pre-patellar bursitis, medial menisci injury, P-uncertaneous bursitis, and fracture tibia. So again, let's see this scenario. It is the medial aspect of the knee joint pain and swelling, but the pain increase or occurs when there is the climbing the stairs, that means the upward movement, and pain over the medial proximal tibia, and McCurry is negative. So here is another important, which is the McCurry test. First of all, let's see the P-uncertaneous bursitis or tendinitis. What is it? First of all, what is P-uncertaneous? P-uncertaneous is a terminal point and it is located in the medial part of the upper part of the tibia, and here three important muscle attachment occurs. One of them is sartorius, second one is the gracilis, and third one is the semitendinosus. That means SGS, sartorius, gracilis, semitendinosus, and they are collectively known as gyropes or P-uncertaneous. Sometimes what occur in this P-uncertaneous, there inflammation occurs, so there is the pain and swelling occurs in the medial aspect of the proximal tibia, and it is known as P-uncertaneous bursitis or tendinitis, because the P-uncertaneous, these three tendon group are known as the P-uncertaneous. So what is P-uncertaneous bursitis? It is the symptomatic inflammation of the P-uncertaneous. That means these three important tendon of the muscle, or it is bursa, who is located at the medial aspect of the knee. This is very, very important. It is the medial aspect of the T. That means the medial aspect of the proximal tibia. And this bursa, it is located deep to the P-uncertaneous tendon. So there may be inflammation of the bursa, there may be inflammation of the tendon. And what is the clinical presentation? Clinical presentation always pain and swelling along the proximal medial tibia, and it is exacerbated by the ascending and descending. That means when a patient go upward by the stairs or go downwards to the stairs, then the pain and swelling aggravate. And what is the treatment? The treatment is the physiotherapy. And also here we can see the McCurry test. McCurry test, it is the diagnostic tool for the menisci or medial menisci injury. As the McCurry test negative, that means there is no menisci injury. Here this scenario again, see this is the pain swelling medial aspect of the knee joint, that means P-uncertaneous point, and pain occurs during the climbing, but not in the flat ground, medial proximal tibia, and also the McCurry test negative. So our answer is the P-uncertaneous bursitis or P-uncertaneous tendinitis. Other option here such as the anterior cruciate ligament tear. In case of anterior cruciate ligament tear, there is the development of anterior draw test. There the positive anterior draw test. So the anterior cruciate ligament tear, there is the anterior draw test positive. In case of pre-patellar bursitis, it pain swelling occurs above the knee joint or anterior to the knee joint. Medial meniscal tear, in the medial meniscal tear, there is the McCurry test positive. And fracture of the tibia, in case of the fracture tibia, actually in case of any type of fracture, the movement of the limb or movement of the affected part is restricted, but here movement possible because walking possible. So the fracture tibia is not answer. So our answer is the P-uncertaneous bursitis or P-uncertaneous tendinitis.